This is Michael Smith of MedPage Today. I'm in San Diego at the annual meeting of the American Thoracic Society. Getting drugs to the target is always a challenge, especially in cancer. Dr. Michael Loebinger of University College London.
What my research has looked at is it's actually looked at producing a very targeted therapy. So it's developed cells which can specifically home to cancers throughout the body, wherever they are, and actually deliver a specific anti-cancer agent to these cells, destroying them in more of a sort of seek and destroy approach than the previous sledgehammer approach. So the way we did this is we really combined two areas of research. The first is the use of adult mesenchymal stem cells. Now these are adult cells which are found in everybody's bone marrow. They're very easily extracted and they can be taken pretty easily from everybody. They have this innate ability which allows them to home towards tumours throughout the body. And what we've done is we've engineered these cells to actually produce a protein which kills cancers. We've made them produce TRAIL, which is an acronym for TNF-related apoptosis-inducing ligand. And what that does is it actually has the ability to destroy and kill apoptosed cancer cells, but not normal cells. So this combination of two approaches seems great for this kind of therapy, in that we have cells which can home towards tumours, and then they are armed with something which can specifically kill the cancer cells but leave normal cells intact.
The approach prevented the development of cancer in mice and appeared to cure cancer in other experiments. But Dr. Loebinger cautioned the research is in its early stages.
I mean, there are some unanswered questions, as there always are at this stage, and we would need to have better understandings of the role of stem cells themselves in cancers, and also the best timing and dosage of therapy is yet not known. But certainly, we think that at this early point, it's quite promising.
Turning to bacterial illness, Dr. Carolyn Cannon of Washington University in St. Louis is using silver compounds loaded into tiny nanoparticles to attack infections of the lung. The approach has been successful in experimental animals.
We were surprised and thrilled to see 100% survival advantage in mice treated daily with SCC22 loaded nanoparticles at doses significantly lower than those used to achieve a similar survival advantage in twice daily dosing of unencapsulated SCC22. Treatment with SCC-loaded nanoparticles also minimized weight loss and the bacterial burden in the lung, and reduced the spread of bacteria from the lung through the bloodstream into the spleen. The depot delivery provided by the nanoparticles allowed dramatic reduction in both the amount of drug delivered with each dose, as well as the number of doses required to achieve the clinical effect. In our view, SCC-loaded nanoparticles administered via nebulization on a once-daily basis epitomize convenient and effective drug delivery that encourages patient compliance, thereby ensuring successful treatment. In addition to activity against Pseudomonas aeruginosa, these SCCs are effective against every bacterial species tested to date.
Today's preclinical research is tomorrow's treatment. In San Diego, I'm Michael Smith, MedPage Today.